Joy News Desk on a Monday morning. Coming up, 7 cases of Omicron variant infection recorded at the community level. That's the latest from the Ghana Health Service. After Ghana recorded its first case about a week ago. We'll hear from the Director General of the Ghana Health Service, who featured on the probe last night with MFA Apao. Also coming up, ECG restores power to Odumase KROBO in the eastern region days after the youth there impressed on the IGP to use his office to prevail on the electricity company to restore supply when he paid a visit to that community. Also, teachers and colleges of education across the country to lay down their tools in protest over an entire year's non-implementation of their updated conditions of service. We have business and sports also as part of this package. My name is Benjamin Akakwo. This is Joy News Desk. We'll be right back. Let's start with some COVID-19 related news, and it's official. The Omicron variant, which is largely driving a 4th wave of the COVID-19 pandemic in other countries, is now spreading within our communities here in Ghana. At least 7 cases were detected from after the last sequencing of samples collected from the community. Last week, health officials found 34 cases of Omicron among travelers who were arriving at the Kotoka International Airport. This led to the introduction of new guidelines to prevent the further spread, including a no vaccination, no entry policy. Director of the Ghana Health Service, Dr. Patrick Kumambwaje, has been giving details of the new measures.
Of the mandate, and on 30th, the Minister of Health actually spelled out the mandate, which will come up in January at a date that he will fix, of course, based on the performance of the month's vaccination. And we have 2 groups. We have venues and we have people. So for the venues, we know cinemas, sports stadia, restaurants, and I think beaches and clubs. These are the venues that will be affected. Of course, that list can vary based on the kind of EI that will come up eventually. And then
so we are likely to see cinemas being closed again?
No, I'm not saying. Say you have to be vaccinated to go.
To go, okay.
That's what it is.
Okay.
I'm not saying to close that. You have to be fully vaccinated. When you watch football match and the stadium is full, everybody there is fully vaccinated. Okay. And they test before they enter. You see, so that is, and we also have people, all public government workers are to be fully vaccinated. All health workers, and I've told all our staff, are to be fully vaccinated, both clinical and non-clinical, because you have had the opportunity to get vaccinated. Commercial drivers will have to be vaccinated. So
all these groupings are being engaged? You are engaging your
them?
staff?
Yes.
We are engaging the transport?
Yes. All engagement is ongoing. Okay. And so schools, when we open schools, it's likely that based on the final research that the universities, SHS, and all those people will have to be fully vaccinated.
And
before.
Teachers as well?
Of course, teachers, including the teachers. So, I mean, teachers are government workers. So even if you take them in the school as teaching and non-teaching staff are all part of the group that will be affected. So we have them in that group. The issue is if you're going to watch a football match, you need to be vaccinated. And that's why we are spending this month giving more opportunity for people to get vaccinated so that it becomes more easier to do.
Okay, so
how do we look at it? It's simple. Everybody has a card, a verifiable card that you can verify by a person, of course. And you need to carry an ID card to see that the card you are holding is yours. And there are systems in the database that can let us know whether it's yours or not yours.
But the short codes you put out, some people say they checked and it's still not working.
There are few. We've been correcting as many as possible. We had a batch that got a problem, and so we continue to tell people that go, if you scan and it's not coming, go to where you had a vaccination and it will be activated. Those who are traveling out of the airport, we have a whole desk there that continues to check and make sure your card is verified, because when you get out there, they will check your vaccination card. If it's not, you are not vaccinated, there are people who have been returned because they were not vaccinated. So Ghana is not the only one that is introducing this.
Okay, so there are loads of events this festive season. Some have already started. Some went yesterday, amongst others. Some say, Memuna Isaka, from his observation or her observation, says many were not wearing masks. Was the plan to avert a fourth wave, especially with the new variant?
I think the plan is not just for the health sector, but also for all of us to be. You may be asleep and your son will go clubbing and then come and infect you. And so we all have to be part of that engagement to ensure people adhere to the protocols. We have also engaged the tourism board, and we have strict rules for all those things. But I believe that they'll be reviewed. I mean, there is happening now, and we will continue engaging. That's why we continue.
Gabriel is informing us that some events, nobody checked vaccination card.
We haven't started that. That is in January.
In January.
So now the mandate is not now, it's January. So people are given the opportunity to spend this month vaccinating so that when the mandate comes in, you will not complain that I was not given the opportunity. That's why now we are carrying the vaccine to you.
So that is the Director General of the Ghana Health Service. But even before this takes off, the Ghana Health Service says the Omicron strain is already spreading inland. Listen again to the Director General of the Ghana Health Service, Dr. Patrick Kumabwaje, as he disclosed this to MFR Power.
We saw the first group of about 34, and that was those at the airport. At the time, we had sequenced about 66 community samples that were negative. The current one is giving us some Omicron in country. I think about 7 of them have been reported within the community sample, but that is to be expected because we are letting as people enter, they are more likely, we may be having people who are incubating. So we have seen some now, but still the leading variant is still the Delta among the community.
Okay, so you've talked about 66 communities. Earlier you said 34, but I was asking if we know how many exactly in terms of Omicron after the sequencing, because the earlier communication was 34. Has it increased? Do we know how many exactly?
The 34 was for the 116 at the travelers that was done. At that same time, we had done about 66 community samples, which were labs within country, and that's 0 for Omicron. The second batch, and I think about 40 or so, we have seen some Omicron in country.
And you say that's a 7, so in addition to the 34, that's all?
That's what we know.
Okay.
That's what is recorded.
Okay. Well,
so as you go on to do your sequencing, you may find some. The most important thing is that it is in the community, and so that's what the caution for us to be more careful.
So are we chasing it? Do we know we are in control? 7, in which communities you would want to tell us?
The most important thing is that all the preventive measures still apply. As to whether it is prevention through the mask wearing, hand washing, social distancing, they still work. Vaccines still work. Even though there is some evidence of some escape, it still works. So all the measures that we have still applies. What we need to do is intensify it and make it more effective to prevent transmission from one person to another.
Let's talk some electricity-related news now. And the Electricity Company of Ghana says it has restored power to KROBO in the eastern region. The announcement was contained in a statement issued by the ECG. It follows a visit to the community by the Inspector General of Police over the weekend. His visit comes after tensions there resulting from disagreements between the indigenes and the Electricity Company of Ghana, that is the ECG. The utility company closed its KROBO district office following threats from some youth groups after a recent demonstration. Residents of Somanya, Odumase, Kpong and its environs have been without power for almost a week. Now, during the IGP's visit to the area on Saturday to assess the security situation there, the residents urged him to intervene in the matter.
Honorable IGP, I wish you use your high office to persuade ECG to switch on the lights for now as to resolve the issues. Because in the night, the dark alone is a security threat. Yes, the way people are stealing people's items, the things, is a security threat. Somebody can be in the dark and misbehave. Excuse my language. Yeah. So please, I want you to use your high office and the other leaders to persuade ECG to switch on the light for now as to resolve the issues. Thank you.
You are saying that
because of this outage, in fact, things are not being well. Both security aspect, maybe economic aspect, because you realize that shops are collapsing. People who deal in this kind of frozen foods are collapsing, and everybody is crying. In fact, please, like we beg you, whatever you have to do, just with ECG and this light to be resolved back to us. Whilst we look into the matter, we'll be very happy. Thank you, sir.
yes,
Both don't say that we don't pay like, but our bill is too much high. So we are pleading if they will claim to solve that issue. For instance, to me, I was paying 100 cities, current bill. All of a sudden, 1,000 plus,
they have
10,000. So we don't know where that kind of problem came from. So that's the whole issue.
Well, Dr. George Kofu Dampari, the IGP, said more police officers would be deployed to the area to avert further violence.
Future is in your hands. Don't think about the challenges you are facing today. They will be resolved.
Thank you.
But whilst we wait for Amen. But whilst is my brother. But whilst we wait to resolve that, we can assure you one thing. We will protect you. Because that is our job. But for the protection of you to be complete, we want you to help us. Tell your brother, tell your sister, there is nothing good in being bad.
And that was the IGP there. Well, joining us now over the phone lines on this conversation is the Tema ECG PRO Sechiwa Mensah. Good morning, madam, and many thanks for your time here on Joy News Desk. When exactly was power restored?
Late afternoon yesterday, but not all the areas have power because some of them have faulty transformers. So we are still working on replacing those transformers. So a majority of the customers in the enclave have had power since late afternoon yesterday. Those without power currently are those with issues concerning the transformer, which we are still working on with the support of the security agency.
How far would you say negotiations have gone? What is the current state of negotiations?
Negotiations concerning what specifically, please?
So I know, for example, there have been interactions with the people on the back of violent acts, part of which resulted in the ECG taking that action. So how far in terms of deliberations with the people in terms of maintaining peace? That's what I mean.
Well, we've had some engagements with some people from the communities. We have always stated that we are open to further engagements. We are hoping that this issue will be resolved. And we also entreat all customers that if you have any issue with a bill, please present it to any of our offices rather than taking an entrenched position of deciding not to pay bills and actually asking us to cancel the debt. I mean, that is not feasible. So if there are any issues to be resolved, please come by our offices so we can all work through it. But to take an entrenched position and to base it on a certain memorandum of understanding, which we still do not have a copy of, that would not be fair. Besides, it's business. We are trading. If we are giving something to you which you have used and gotten whatever benefit from, it's your responsibility to pay up for it. So we've always stated that we are open for whatever level of engagement, and we are still open to engagements to ensure that this issue will be resolved.
All right. You took the wind out of my sail when you started talking about the bills and all of that, which is another thorny issue. But apart from the aspect of calling people to come to your offices to present their bills so that it can be worked out, what are you doing to prevent these bills getting to the people moving forward? Some were saying they were getting 100 CDs, now they're getting bills in the thousands. What is ECG doing about that?
I would have to. We haven't spoken on Joy since these issues happened. So if there's a bit of time and if you would permit me, I would have to give a bit of a historical background.
Just try to make it a bit brief still. Thank you.
Pardon me?
Just try to make it a little brief.
It would depend because your question is kind of deep. Okay, so we've had these issues, and the period for which the bills have been problematic, so to say, is between 2014 and 2017. So the company decided that we'll ring-fence the 2014 to 2017. We'll set it aside for further investigation. Mind you, ECG has investigated and cleaned the data. PLC has done same. But then some of the customers still insist that all these works have not gone on. And this problem was as a result of billing software we're using, a technological issue. And this happened across everywhere ECG works. It was not just the KROBO area. But then they claimed that they had a certain memorandum of understanding with the government, the Nkrumah government, which prevents them from paying electricity after 50 years of the construction of the Akosombo Dam. We have asked for a copy of this memorandum of understanding, but we have not gotten it for the past 4 or 5 years. We have still not gotten it. So we ring-fenced that problematic period. Now, from 2018 till now, there hasn't been any issue whatsoever with the billing. Everything has been correct. Everything has been correct. Even if something is wrong, we ask that please come by our office. Let us know. We have your data in our system. We can print your consumption chart for you. We can all sort of go through the consumption to be sure of what the right figure is. And we do data cleaning every now and then. There are times in other districts, other offices, customers come in with bills which we go through. Some are below, some are above what they are supposed to pay. We go through all the time. So if there are such challenges, we ask that customers should please come so that we would sort of solve it. But to take an entrenched position and to demand that we should cancel the debt from 2014 to as of now, this very 2021, December or November 2021, that would definitely not be fair to ECG.
Right.
And that cannot happen. We do not have the mandate to cancel such debt. And even that, on what justification, on what moral right do we stand on to say that, oh, they couldn't pay their debt for all this while it's accumulated, so we are canceling it. That it just cannot be. So for calling for cancellation, that cannot be. However, we are open to negotiations, even if it will take 4 or 5 years to clear a certain to clear a debt by a certain customer. We are saying that we are willing to go the long haul. So we've actually made a concession. Usually, if you owe ECG between 50 to 60 thereabouts, you're supposed to pay up that lump sum. Then we spread the rest for 3 to 6 months. But in this case, we are making away with that concession. I mean, with that policy. We are making away with that policy. So if a customer can pay from, let's say, 50 cedis a month or 100 cedis a month to reduce that bill, if it will take 5 years, 4 years, we are willing to go the long haul. But still, they were asking for cancellation, and it just can't happen. It
can't happen. Well, Sechiwa Mensah, thank you so much for joining us with the details of that, for giving us the historical antecedents as well. Sechiwa Mensah is actually Tema ECG PRO, and she joined us there with the situation. Let's continue now from the teachers' front, and teachers in colleges of education across the country will, from the first week of January 2022, lay down their tools in protest over an entire year in the implementation of their updated conditions of service. This is contained in a statement by the Colleges of Education Teachers Association, CTAG, which gives government up to the end of the 2021 year to clear up all arrears owed them, or they will strike. National President of the CTAG, Prince Obeng Hima, joins us live for more on this. Prince, thank you for joining the conversation on Joy News Desk. Let's start from how exactly we got here. What led us to this point?
Good morning to you and your cherished viewers, most especially tutors across the 46 colleges of education who are watching us live. We are where we are because in 2017, CTAG negotiated for conditions of service which wasn't implemented up to 2020. Apparently, we applied to the National Labour Commission and reported the attitude of government at the early part of this year. And the National Labour Commission instructed CTAG and government to sit down, have a conversation around it, and reach consensus. After weeks of discussion, we came to consensus on the 24th of September that we were going to be compensated for government not paying what they ought to have paid from 2017 up to 2021. And the compensation was to take effect from 1st January 2021 up to October 2021. The roadmap for the payment, or the payment schedule, ought to have been 3 equal month installments starting from October, November, and December. Every month, they were going to pay 3 months arrears. Okay. October passed without any payment being effected. We got to November, that wasn't also done. And we are in December. Considering the hardship that tutors are going through and the fact that the work of a college tutor, we all admit that the nation depends, or the success of the nation depends on education. And the trainer of trainers, colleges of education teachers, are being treated this way. I think it's unfair. So we are simply saying that we're still within the period that we are mandated to respect the terms of the agreement, that is December.
Right.
We expect government to put together what ought to have been paid in October, November, and add that of December and be paid this December, out on which we'll consider it as government having violated terms of agreement that we signed. And for that matter, we would have also have no option than to respond swiftly to it by withdrawing our services come the 6th of January 2022. And that was the decision of the highest decision-making body of the association. And as leadership, we have that mandate to carry on the decision of the structures of the association.
So by the end of December, just to get it clear, you want the arrears, what should have been paid in October, November, and December put together. Don't you feel that is a bit of a tall order, especially as even in October and November, those arrears have not been paid? I mean, shouldn't you be expecting maybe something for December? What are your demands in that regard?
Exactly as we've captured, because we signed the MOU, and as we speak, government hasn't officially communicated to us in writing if they have any challenge. So for you and I to engage in guesswork as to whether government has any challenge, we don't want to get along that tangent. We are hopeful that we're still within the period. December hasn't ended. This is a clarion call. This is a gentle reminder to government that, hey, you have responsibility, you have to meet the terms of agreement that you signed onto, so that we wouldn't get to January where we take people unaware, because parents will expect that their wards will be in school. We want that around this time, all stakeholders who are interested in teacher education will take pains to advise government to do the needful.
Just to clarify on this matter right before we move on. So are you saying that if you get paid for a tranche of 3 months or maybe even 6 months, once the rest is not paid, you will still embark on this strike in January?
Once we've not been communicated to, if government has any challenge paying what is supposed to be paid or respecting the terms of the agreement, we take it that government is cool with that. Because we signed on our own free will, considering the funds available, considering processes we had to go through, and considering CTAG to what we had to. Or rather, if we all have to admit, the work of a college tutor is enormous. to train somebody, to mentor somebody. Coming into college, sometimes within the perception that is because of job situation, I'm coming in within a semester or two, I'll move away. To be able to mentor such person to accept, or such a person, to accept teaching profession as, something that he has to do at the end of the course, it's just not easy. So when we do all these things and the letter that is due us is not being given us, it's worrisome, especially when people who have had a chance to go and do PhD, because of this treatment method outward, many of us, when they finish, instead of coming back to contribute to the work we are doing, they find a way into the traditional universities where we have enhanced conditions.
Right.
So it's about time that trainers of trainers are well taken care of.
Thank you very much. And that is Prince Obinghema, National President of SETAG, speaking to us there on the back of that planned action. Let's now move on. And the United Nations Children's Fund, UNICEF, is today marking 75 years of providing humanitarian and developmental aid to children worldwide. The UN Humanitarian Agency has a presence in 192 countries and territories, including Ghana. Out of its 75 years of promoting the welfare of children across the globe, UNICEF has spent almost 40 years in Ghana advocating better healthcare, education, and sanitation-related issues. In healthcare delivery, for instance, it has provided various logistical and technical support for neonatal care services to reduce infant mortality at the district and regional levels. The promotion of kangaroo mother care, also known as KMC, at various district hospitals has been key in reducing child mortality. UNICEF Health Specialist Priscilla Wabil, on a tour to beneficiary district hospitals in the northern region in 2019, threw more light on how much impact the program has made on Ghana's healthcare delivery.
Care is a very simple program. We call it a program, and it encompasses skin-to-skin contact between the mother and the baby, and then for prolonged hours, especially for the small babies, because they are not able to regulate their body temperature. And then also the second part is the feeding aspect, where they have access to the breast. They are in between the mother's breast, and also comes with, when you look at the boxes down there, there are some special small cups, graduated cups, feeding cups, where mothers would express the breast milk and then feed the babies, because some of them have difficulty in attaching to the breast and suckling at the breast. So we have these cups that mother would express and be able to feed the baby by cup. And then as the baby matures and develops, the baby will now be able to attach to the breast and suckle well. Then the last component is the follow-up care, because once they are small, they were born small before their time, they need to come regularly for follow-up, and then the nurses will continue to monitor them. And we have seen remarkable improvement in their survival. They gain weight faster. They have less infections because you have fewer people touching them, because once they are tied in between the mother's breast, you have fewer people wanting to carry the baby, fewer infections. And the other thing is that whilst they are in skin-to-skin contact with their mothers, the movement of the mother, the breathing of the mother, the heartbeat of the mother stimulates the baby to continue to breathe. Because when they are small, they sometimes forget to breathe and they stop breathing and they can just die. But that posture of being with the mother, and the heartbeats, someone said, it's like a song in the baby's ears. And the baby is stimulated to continuously breathe. And the mother keeps rubbing the baby. And the baby bonds very well. So that's nurturing care. When we talk about early childhood development, that's how it starts. The nurturing care, bonding with the baby, feeding. So that all helps to improve the survival of these babies. They gain weight better, they are protected, and then...
Now, in the area of education, the agency has been keen on retaining adolescent girls, especially in school. It has thus identified the provision of wash facilities in all schools to make school-going attractive and more exciting for the girl child. Regional Director for West and Central Africa of UNICEF, Marie-Pierre Poirier, told Joy News in 2019 Ghana had so far done well in that regard. They are, however, collaborating with government to improve the situation.
We are looking with the government at what could be done about this, very innovative ideas. First of all, particularly for the girls, you were mentioning child marriage and girls dropping out. A simple thing, sanitation facilities. If you don't have a sanitation facility in the school, particularly for the girls in specific moments of the month, how embarrassing. Maybe they would like to go home and then they don't come back. Sanitation facilities separated for girls and boys will do a long way to make sure that the kids stay there. The ambiance in the school, the safety in the school. And Ghana is a member of the Safe School Initiative.
Well, joining us on the back of that via Zoom is the Chief of Communications at UNICEF Ghana, EULETTE EWART, for a conversation on this milestone. EULETTE, a warm welcome to Joy News and congratulations to you and your team across the globe.
Thank you very much and good morning to you as well, Benjamin.
Great. So tell me, 75 years globally and 40 years in Ghana, how does that make you feel?
Yeah, it's great. I mean, UNICEF is extremely excited about today. We're thoughtful as well. Certainly, over the last 75 years, UNICEF has achieved a lot. You've already outlined many of the areas in which we worked here in Ghana. We've been in Ghana since 1982. We've achieved a lot to help to transform the lives of children by ensuring that we're respecting and promoting their rights and well-being. But we realise that the job is not done. There are still many challenges that face children, adolescents and young people, not just in Ghana, but around the world. Many of them are shared challenges. And so the strength of UNICEF is that it works at a global level and also nationally in order to be able to apply its levels of expertise, experience of working in country as well, and working, of course, with key partners in order to help to improve the lives of children. And that's what we aim to continue to do in whatever circumstances.
Right, and this is certainly worth celebrating, but what exactly in the 75 years stands out for you in terms of impact?
Sure, okay. Well, I'll speak very much for Ghana. Ghana can celebrate many firsts, actually, and UNICEF is happy to have been part of that. So, as mentioned before, UNICEF opened its doors here in Ghana in 1982. About 8 years on from that, Ghana became the first country in the world to ratify the Convention on the Rights of the Child. This is a convention, as our regional director said, this is a convention which is the world's most ratified convention. It seeks to protect and respect the rights of every child, and Ghana led the way for the rest of the world. Following that, just this year, Ghana was the first country in the world to receive the COVID-19 vaccine through the COVAX facility, and UNICEF played a significant role in that also in providing the supply and logistics of the vaccine and enabling Ghana to receive that. We've been working very closely with the government to seek to strengthen the health systems, seeking to ensure that the right equipment is put in place to ensure that we can receive such vaccines, helping with regard to communication and community engagement in that area. But COVID is not the only area in which we've been working in recent years. We can also speak to the fact that with the support of UNICEF and other partners, many girls now are less at risk of anemia. Anemia was a real challenge for teenage girls aged between, adolescents really, between 10 and 19. This has really impacted their schooling as well because they're not able to concentrate very well at school as a result of anemia. So working with the government a few years ago, UNICEF supported the establishment of the Girls' Iron Folate Tablet Supplementation, otherwise known as GIFTs. As of this year, more than 2.5 million girls are receiving GIFTs. As a result, they are now at less risk of having anemia, are able to concentrate more in schools. Right. So there are many other areas. We can talk about water, open defecation, health, protection of children as well. There are many areas in which we've really seen some successes, actually. Please allow me to just say more. Just before, I know you want to come in, just one more, in the sense that now more girls are able to access justice more easily as a result of the establishment of 10 new child-friendly gender-based violence courts. So this enables, and with thanks to Joy for covering this in previous months as well, this now enables girls, or should I say victims of violence, to be able to go to court without having to see their alleged perpetrator of the abuses. Just enabling children. Going to court is very difficult anyway, so enabling girls to have the opportunity to be able to present their case fairly is another area in which UNICEF is happy to have supported.
EULETTE, to cap off the conversation, two things I want you to quickly address. How is the commemoration going to be like here in Ghana? What form will it take? And secondly, what does the huge future hold for UNICEF and children in Ghana?
Okay, so the first one, this afternoon, we are aiming to have a lovely moment with various invited guests to view a photographic and art exhibition where we'll be showing some of the work achieved by UNICEF in recent years, and also illustrating some of the art which has been crafted by children as they reimagine their future. Some children will also be speaking at the event as well and sharing their view, and we'll be also premiering a film which reflects UNICEF's 75 years, and Ghana plays a key role there. In terms of moving forward, there are 4 key areas of priority across the globe for UNICEF, which will also continue to be a priority for us here in Ghana. And they include addressing the learning crisis, seeking to ensure good health for children, particularly with the focus on vaccinations and immunizations, climate, water, and also violence or mental health and well-being of children. But there are many more areas, so we're delighted to continue our work here in Ghana.
EULETTE, it's been a pleasure. Thank you for joining us on Joy News Desk. EULETTE EWART, Chief of Communications with UNICEF. Let's do our final story before business. And Amejope in the Volta region is the highest human settlement in Ghana. The community, which is at the base of the mountain Gemi, boasts of breathtaking scenic views and a conducive environment for hiking and camping. A US-based software engineer, Dr. Emmanuel Ami, believes the community where he comes from is yet to tap and fully benefit from its tourism potentials. He is determined to change that as he has now settled in Ghana and is volunteering as the manager for the Amejope Ecotourism Center. Maxwell Agbaba has the rest of the story.
Amejope means origin or home of humanity, or where humans come from in Ewe. Amejope, the highest human settlement in Ghana, is situated north of Ho in the mountainous region of the Ho municipal district of the Volta region. It is presently located in the newly created Ho West District Assembly. Amejope is located at the foot of the Gemi Mountain, a rocky mountain that forms part of the Ekuapem Togo range and can boast of 4 natural gifts: the Ute Falls, Mount Gemi, the cool and varied weather, and the beautiful landscape. Finally, I'm at the base of Mount Gemi here at Amejope. I'm here to meet the manager for the Amejope Ecotourism Center, Dr. Emmanuel Ami. Doc, nice to meet you.
Nice to meet you.
What is the history of Amejope and what is the meaning of Amejope?
Amejope in the Ewe language means Amewope Jope, where humans come from.
Where humans come from.
Yes, okay. Amejope. For the travelers going into Togoland, they have it as Amewope Jope.
Okay.
So when the travelers and traders were hiking through here to descend to Togoland, this is where they would rest for the others to join them. That is Amewope Jope.
Wow.
I live in the United States, in California, Los Angeles.
Okay.
I'm a dual citizen of Ghana, definitely born and bred in Ghana, Accra, specifically Dansoman. Tourism is a big industry, and the world needs to go around to see what else is in other parts of the world. And my interest is to have our locals also interested in coming to see beautiful places like mountain tops, waterfalls, let's say caves, canoes, and world sites such as the Cape Coast, the slave castles, and so on. But for Amejope, we have the mountaintop, we have the waterfall, we have some caves. We have very interesting views.
Okay.
And my interest was to bring tourism up to where the rest of the world, or most of the first world, has it. That is to offer first-class tourism for Ghanaians as well as all of the world. So for now, there's a website which is amejopevirtualtours.com. There
you created that?
Yes, I came up with my technology skills in IT, and I came up with the website amejopevirtualtours.com.
Wow.
The former philosophy I came to meet at the tourism office was one comes to see, to go tell a friend, to tell a friend, to tell a friend. But the world today in the 21st century has moved beyond that. And we are trying to leverage technology to be able to overcome the difficulties that the coronavirus has placed on the tourism industry. So with the virtual tourism concept, our tourists in the diaspora and in the other parts of the world will be able to click and have a pay-per-view experience for 45 minutes and have 360 views of the mountain, 360 views of our waterfall, 360 views of our caves and our wonderful trails.
Wow. So they don't necessarily have to come here to come and pay to view, but they can do that online.
Exactly.
And Amejope can also raise some funds, some money for
that. Is correct, to leverage the difficulties that COVID-19 has placed on the tourism industry.
And you created this?
That is correct.
Doc, you're a genius. I'm dreading.
Interesting scenes from Amejope, the highest human settlement in Ghana. We take a break now and return with Business with Daryl Kwao.
Good morning, welcome to Business. My name is Daryl Kwao. A commemorative gold coin has been launched in the name of ASANTEHENE II for his peace-building endeavors, including the decades-long Dagbon crisis and election mediation. The 24-carat coin, according to government, is an initiative to also promote value addition to Ghana's gold minerals locally. Prince Apia was at the special event that launched the coin, in our report.
The event brought together about 600 high-profile persons from every sphere of Ghana's gold and natural resource industry. The commemorative gold coin was meant to celebrate the ASANTEHENE as a pillar of peace in the country. Governor of Bank of Ghana, Dr. Ernest Addison, explained the essence of the coin.
The gold coins will be of no monetary value. By that we mean it would not be a medium of exchange and not exactly a legal tender. As a result, the commemorative coin is not expected to display any face value to avoid the risk of being confused with legal tender in circulation.
The event, organized by EON3 Group, PMMC and the Lands and Natural Resource Ministry, supported. Sector Minister Samuel Abdullahi Jinapo says the initiative is to promote the value addition of gold locally.
This partnership is in accord with the far-sighted vision of the distinguished President of our Republic, His Excellency Nana Addo Dankwa Akufo-Addo, to transform our national economy, which is dependent on the production and export of raw materials, to a value-adding, industrialized and prosperous economy. The addition of these gold coins, embossed with the image of His Royal Majesty, will go a long way to help support our efforts to promote the jewelry industry.
The commemorative gold coin was also to celebrate ASANTEHENE's socio-political role in Ghana's economy. Here is ASANTEHENE II.
It is my hope that the success of the commemorative gold coin we launched tonight will convince the nation that there's room for more innovative ways to help us to maximize the basis of our nation's wealth. ASANTEHENE will play its part in this exercise and will encourage other traditional leaders to to harness the creative talents at their disposal to make it a worthy global effort.
The ASANTEHENE reiterated the need for the country to work to protect the peace it is currently enjoying.
I ask our leaders from all shades of political opinion, our social commentators who control the space of public discourse, and captains of finance and business whose enterprises depend on the climate of success. It is time to stop the nation bleeding to extinction. The good people of Ghana take pride in their commitment to democratic governance. We have been proud to be an oasis of peace in an isle of torrents, and our record as a thriving democracy has served us well and made the chosen destination of many investors. What we dare not forget is that democracy is not a static object. Nothing in statecraft really is. Democracy is a work in progress.
Vice President Dr. Mahmoud Bawumia acknowledged ASANTEHENE's contribution to Ghana's peace.
We saw what he did in 2016 when this country was on the brink as far as the election was concerned. We saw his action and how he brought peace. We saw Dagbon, and after which he worked on for 17 years before we got peace in Dagbon. And the commemorative gold coin is basically signifying, and it's a fitting tribute of his stature as a pillar of peace in Ghana.
Meanwhile, millions of Ghana cedis were raised from auctioning of the initial coins. The proceeds, according to organizers, will be invested in the agriculture sector. Some will also be used to establish a cultural resource center and automated conflict resolution center. Prince Apia reporting.
All right, more news on our website, myjoyonline.com. Our biggest story there, Ghana is 8th biggest economy in Africa with size of $72.4 billion. You can read more about it on myjoyonline.com/business. My name is Daryl Kwao.